This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Whether you're a student athlete or a weekend warrior hitting the pickleball court, overhead injuries affecting the elbow and shoulder can be quite common. Dr. Michael Laidlaw, an orthopedic surgeon with Mercy Health, shares some ways to prevent these injuries and shows us how Mercy Health's team approach to orthopedic care can help get you back in the game.
Hello, I'm Dr. Michael Laidlaw, orthopedic surgeon with Mercy Health with subspecialty training and fellowship training in sports medicine. As a team physician in our Anderson market and the East market for Mercy Health, a lot of times working with our athletic trainers and even the athletic directors there at schools can really try to help set a good balance for teaching young student athletes the ability to not only have a good warm-up routine and activities, but also when you're working with strength and conditioning coaches, how to be able to work on recovery processes to be able to help limit some of these sports-related injuries that you can get with repetitive use of your shoulders for overhead sporting activities. So pickleball, very similar to tennis, but obviously is a little bit different in terms of the weighted activity of the racket. At the end of the day, repetitive motions like that and reaching for a ball and even getting out and enjoying playing hours and hours can strain even some of the muscles and tendons around the shoulder. It could be something as simple as a sprain to some of the ligaments and tendons around the shoulder, but even more so the rotator cuff tendons, the biceps tendon, and even aggravating some collarbone joint or early arthritis in the shoulder that could be exacerbated from the sport itself. It could be as simple as playing pickleball a little bit longer than you normally would have, tennis and overhead activities, swimming, or even everyday life and living where you might be putting a box of groceries up, playing with your kids or grandkids, or even putting on and off a jacket. So conservative or non-operative care for shoulder-related conditions can range from as simple as modifying your activities, being thoughtful of maybe how long you're playing your sporting activities, to even the frequency at which you're doing it, but can also then include maybe prescription strength anti-inflammatories, potentially discussing getting into see our formal physical therapist. A lot of that translates to Mercy Health, where we have excellent physical therapists and athletic trainers. At both my offices at Eastgate and Anderson, I can walk over and actually speak and work with our athletic trainers and physical therapists to make sure that the handoff from not only surgical when it applies or non-surgical related treatment options is maximizing a patient's care and recovery and getting back to life. When it comes to injuries about the shoulder, I would just say at the end of the day, reach out. There's multiple ways to get in touch with our Mercy healthcare providers, and me included, with online scheduling, also calling our call center to be able to make appointments with our providers. For myself, I champion having same day and next day availability for patients. I think that if you're having any questions about the shoulder function or if it's causing you everyday life and living problems, just because you get in to see us doesn't necessarily mean we're starting down a surgical treatment option by seeing an orthopedic surgeon. But I do think it allows the ability to have a full encompassing care to include non-operative care and surgical measures when it's indicated. So again, if you ever have any questions with regard to your shoulder health or musculoskeletal health in general, please don't hesitate to reach out to our orthopedic surgeons here at Mercy Healthcare, and we're happy to care for you.